Good evening, and thank you for joining us. Let me ask you something. When was the last time you thought about your A1C number, your blood pressure, your heart health? Now, when was the last time you stepped on a scale? If you're like many of us, you know that last number by heart. It's even on your driver's license. But here's the truth. The weight number alone can't tell you if you're healthy, but your A1C can tell you if you're at risk for diabetes. This National Diabetes Awareness Month, the American Red Cross and the NAACP are coming together for a real conversation that's long overdue. Because in our communities, diabetes isn't just a health crisis, it's a multi-generational story. It's our grandparents, our aunties and our uncles, our mothers and our fathers, our siblings. It's us. And yet, while we're bombarded with messages about weight loss and the latest miracle drug, too many of us don't know our A1C levels. Too many of us lack access to early detection and preventative care that could save our lives. So tonight, we're flipping the script. We're talking about health beyond the scale, about the numbers that matter, and how our communities can advance our wellness together. But before we dive in, tag someone who needs to hear this or share this live right now and tell us where you're tuning in from. I'm Tiffany Taylor, Senior Biomedical Communication Strategist with the American Red Cross, coming to you live from Nashville, Tennessee. And I'm honored to be joined by a wonderful panel of doctors, starting with Dr. Chris T. Purnell, who is a nationally recognized physician leader, public health strategist, and fierce advocate for health justice. As director of the NAACP Center for Health Equity, she's transforming healthcare systems and creating pathways to equitable health outcomes for communities that have been historically marginalized. Dr. Purnell brings a holistic, people-centered approach to preventative medicine because she believes true health happens when we center community, access, and dignity. Welcome, Dr. Purnell. We also have with us Dr. Courtney Lawrence. She serves as Divisional Chief Medical Officer for Biomedical Services at the American Red Cross, overseeing the Northeast and Central Atlantic divisions. She's a pediatrician and specialist in hematology, oncology, and transfusion medicine. She's also passionate about making life-saving care accessible to everyone. She champions public health, innovation, equity, and the science that connects blood donors to patients in their most critical moments. Welcome to the call, Dr. Lawrence. We're glad to have you. And last, but definitely not least, we have with us Dr. Yvette Miller. She's a powerhouse in transfusion medicine, shaping clinical practices and expanding awareness around the experiences of those living with sickle cell disease and the vital role blood donors who are Black play in their care. In addition to being the Executive Medical Officer at the American Red Cross Donor and Client Support Center in Charlotte, North Carolina, she is a wellness practitioner who reminds us that some of the most powerful health tools require only our time, not our money. Thank you all so much for joining us. Now to our audience, as you have questions throughout this live conversation, we welcome them in the comments and we'll try to get to them during the Q&A portion of this live stream. So to kick things off, Dr. Purnell, this month is all about raising awareness of diabetes and prevention. Diabetes has been commonly referred to as the sugar, but oftentimes that condition is never really explained. Dr. Purnell, could you please tell us what exactly is diabetes?
So thank you so much, Tiffany, and welcome to the rest of the amazing panelists who will be speaking tonight. And good evening, good people, from wherever you are tuning in. I think it's so important that when we talk about health, especially chronic health conditions, that we talk about them through a frame that helps to build understanding. So when I explain what diabetes is in community, I oftentimes say it's a chronic disease or chronic illness It's actually a group of diseases, and it occurs when the body doesn't produce enough insulin, or the insulin that the body produces, it can't use it properly. And when that happens, you have high blood sugar levels. Hence why you sometimes hear people call it the sugar, or I have sugar diabetes, because in the bloodstream there are large amounts of glucose or blood sugar that's circulating. Now, how does that sugar get there? So when you eat and your body breaks down or it digests the food that you eat or drink, that food is then turned into glucose or sugar, and it's released into your bloodstream. Now, when that blood sugar goes up, normally what happens is that it signals your pancreas, an organ in your GI or gastrointestinal system, to make and release insulin. Now, if your insulin is acting properly, insulin is a hormone that then gets that sugar into the cells, and then the cells can use that as fuel. But in diabetes, those who live with the condition, your body either doesn't make enough insulin, so you can't get the sugar out of the blood and into the cell so it can be used as fuel, or your body doesn't use insulin properly. So again, you can't get the sugar out of the bloodstream and into the cells so it can be fuel. Now, when that happens in diabetes, and a person may develop insulin resistance, or your body stops responding to insulin the way that it normally would, that circulating blood glucose leads to a host of complications. And those things could impact or damage your eyes so that you get a loss of vision. Those things can impact or damage your heart so that you have cardiovascular or heart disease. And finally, you can get kidney disease because it can impact your kidneys. So your kidneys don't function as well.
Thank you so much, Dr. Chris, for breaking down what diabetes is, the role that even blood sugar levels or glucose play into that, and also some of the impacts of diabetes. We appreciate you really taking time to break that down. Now, since 1980, the number of people around the world afflicted with diabetes has quadrupled, making it essentially an epidemic. Dr. Lawrence, we often hear about type 1 and type 2 diabetes. What's the difference between type 1 and type 2?
Absolutely. Thank you, Tiffany. And thank you to Dr. Chris for giving such an excellent overview of the diabetes causes. And there are overlaps in the symptoms and the complications that can come from both type 1 and type 2 diabetes. But type 1 diabetes is an autoimmune disease. And so it usually develops over a pretty short period of time. And it's when the body's immune system starts really attacking itself. And in this case, attacking the pancreas, which is that organ that makes insulin. So unlike type 2 diabetes, which can to a certain extent be prevented or even reversed with lifestyle changes like diet management and regular exercise, type 1 diabetes currently has no cure, and people with type 1 diabetes require insulin medication to manage their blood sugar. But type 1 diabetes is far less common than type 2 diabetes. Type 2 diabetes makes up more than 90% of diabetes diagnoses. So tonight we're discussing type 2 diabetes, which affects more than 30 million Americans, because early detection and certain lifestyle changes can help prevent and reverse this disease.
Wow, that really helps us connect the dots between type 1 and type 2 diabetes, Dr. Lawrence, as well as which one we're more so framing tonight's conversation around as it relates to prevention and lifestyle changes, which is type 2 diabetes. Dr. Miller, can you tell us how diabetes or prediabetes is typically diagnosed?
Again, thank you, Tiffany, and for the Dr. Chris and Dr. Lawrence for sharing and really opening this conversation up. So there are typically two types of tests that are used to diagnose diabetes. One of the more common ones that people are really familiar with is a fasting blood sugar test, where you have to fast for 8 to 12 hours, and then a blood sample is drawn, and then they determine how much glucose is present at a level of less than 100, person is generally thought to be normal. If the glucose is between 100 to 125, that's pre-diabetic. And 126 and higher, that means that that person is likely to have diabetes. The test that we're talking about today, the one that we're offering at the American Red Cross, and this one is becoming more common, is the hemoglobin A1C test. So it is a test that measures the amount of glucose or sugar that attaches to the hemoglobin molecule, which is a protein within a blood cell. And this measurement actually gives us an idea of what an individual's blood sugar has been over the previous 3 months. And these levels are, if it's 5.7 or less, the person does not have diabetes. If it's between 5.7 and 6.4, that's thought to be pre-diabetic. And if it is 6.4 or higher, then that individual is likely to have diabetes.
Wow, thank you so much, Dr. Miller. If you're like me, you're over here taking notes because this is critical information, especially about knowing our numbers and understanding what the ranges mean. If you've just joined us, the NAACP and American Red Cross are talking about diabetes awareness, A1C screenings, and how our communities can advance our wellness. If you have questions for our doctors, please drop them in the comments and we'll try to share as many as we can during the Q&A. And if you haven't already, make sure you share this live right now with your friends and your family, with your network, because I believe this information will be information that they can use as well. Now, Dr. Purnell, we've been talking about A1C, blood sugar, and glucose, but you've been very vocal in the past about the danger of reducing health to just a single number, especially when we're talking about our weight number. How does our obsession, I guess, as a culture and as a society with the scale shape the way that we as people think about wellness? And what numbers should we be paying attention to?
Good question, Tiffany. So I think the best place to start is for everyone to understand that your health and well-being, your wellness is a whole person effort. It is not just one aspect of who you are. It's not just your physical health, meaning whether or not how your heart is performing, how your blood vessels are performing, how your organs are performing. It's also mental health, right? It's also emotional health. It's also spiritual health. And so first and foremost, it's so important for whenever we have a conversation, even about a specific clinical condition, that we help people to remain centered in that conversation because we are whole beings, multifaceted beings. And there are so many factors that can contribute to whether or not a person develops a condition or an illness or a disease. So first I want to start there from that understanding. And then when we begin to talk about numbers, like what are the numbers that are important? And yes, knowing your weight is important. Why? Specifically for diabetes, having overweight or obesity can be a risk factor to develop the condition, but you can also develop diabetes and be normal weight. So it's very, very important that you have other numbers that are able to, let's say, summarize your whole health or your whole well-being, so you can really get an accurate picture of what's going on inside. Some of those other numbers is usually, I'll tell people, your waist circumference, right? That abdominal circumference. That's another way to say taking a measuring tape and measuring around your belly, just above your hips, just below your belly button. If you are a woman, that number should be less than 35 inches. If you are a man, that number should be less than 40 inches. Why? Because the fat that's around our belly is a metabolically active fat. And that fat can contribute to the onset of disease, whether that is heart disease, whether that is diabetes, or what we call metabolic issues, okay? So that's another number that's important. As we begin to understand other numbers that are important, you heard others here on the call tonight say about hemoglobin A1C. We'll get back to that. But you should also know your blood pressure. Whenever you go into the doctor's office, frequently, someone comes in first to assess you, and that person takes your blood pressure. So knowing your blood pressure is something that is increasingly important. We have renewed or more recent guidelines around blood pressure control or management so that a person is not at risk for the negative impacts of having an elevated blood pressure. So we're aiming for 120/80. Another number that you should know, and a lot of people don't think about it this way, it's but how many hours of sleep you get in an average night. What is your sleep hygiene? We talk a lot about oral hygiene, but what is your sleep hygiene? How many hours are you sleeping? Because that can be a risk factor, or that can contribute to the worsening of other health conditions, and it can actually contribute to some of the symptoms and the worsening that we see with diabetes. So know those numbers. Other numbers that you should know and you frequently hear your physician talk about or is discussed in community is you want to know your cholesterol numbers, right? You want to know what the lipids are, whether the good cholesterol, you might hear someone say HDL, which protects you, or the bad cholesterol, LDL, or triglycerides, fat circulating in the blood, right? And those numbers are a range of numbers, but typically we're thinking about less than 100 for LDL, greater than 40 in men, or greater than 50 in women for our HDL, and for our triglycerides, less than 150. And because we're talking about whole health, I'm going to end it with a couple of other numbers. How much physical activity do you get in a week? Do you know that number? It's recommended for most adults to get roughly 150 minutes of moderate intensity exercise, and to have at least 2 days out of the week where you're focusing on muscle strengthening exercises. Do you know those numbers? Do you know how active you are? Because again, physical inactivity is a risk factor for diabetes. And finally, what are you eating, right? Are you taking in healthy, good nutrition? Do you know how many servings of fruit, for instance, that you're getting on a daily basis? Even if you're a person who's living with diabetes, while there'll be certain recommendations for which fruit you should intake, there are still recommendations around getting about 2 to 3 servings. And then finally, your vegetables, right? I remember my granny shucking beans and all those types of things, snapping them right there at the table, right? And so we want to make sure, do you know how much vegetables you should be getting in? I tell people, fill half your plate with leafy green vegetables, with things like broccoli, with things like green beans. So that's a fuller or more whole person understanding of the numbers that are important to your health and well-being.
Wow, Dr. Chris, I appreciate you making it so clear for us in terms of what numbers we should be paying attention to, in addition to our weight. And you said something that I think is comment worthy. I hope someone has already put it in the chat for the folks in the back. Our wellness is a whole person effort. That's so good. Our wellness is a whole person effort. Thank you so much for that. Dr. Lawrence, access to care is such a key piece of prevention, but for many Americans, regular doctor visits or screenings can simply just be out of reach. How can community health touchpoints like Red Cross blood drives help close the gap?
Thank you, Tiffany. So we know at least about a third of Americans do not have a source of regular primary care, which is really astounding and a problem that's predicted to get even worse in coming years. And there are many factors that account for this lack of access. There's a growing shortage of primary care physicians, physician assistants, nurse practitioners, and this is a shortage that is projected to get worse over the coming decade. A recent study here in my home state of Virginia found that nearly half of the neighborhoods in our state don't have enough primary care providers to meet the health needs of its residents. And these workforce shortages particularly impact our rural communities. And even those who do have access to healthcare may find that there are other barriers like long wait times, difficulty in transportation, the high costs of healthcare, all of which place a barrier between them and what we consider traditional healthcare institutions. And this is really where community organizations, including the American Red Cross, can come in. So at the Red Cross, our blood services interact with well over 10,000 blood donors every single day across the country. The majority of our blood drives are mobile. So so our blood drives are set up at sites throughout different locations to increase our accessibility to members of the community. These can include schools, job sites, centers of faith, community centers. And every time someone comes in, they're screened before they can donate blood. And they have some very important basic information that's taken at that time. And that includes a heart rate, a blood pressure, their blood hemoglobin level, which can be an indicator of anemia. And these are all simple but very important clinical measures that can help play into our overall heart health. For donors who self-identify as Black, African American, or multiracial, we also provide sickle cell trait screening. Sickle cell disease is a serious blood condition that impacts more than 100,000 Americans and disproportionately more African American and Black Americans. And so knowing whether somebody has a risk of passing on this trait is important for their own health and for their family planning status. But we know despite universal newborn screening, so people are tested for this in the newborn period when they're born into the U.S. hospital system, a lot of them do not carry that health information with them and do not know their trait status as they approach later adolescence and adulthood. So we really feel that at Red Cross, we're doing a huge service by providing this information back to our blood donors so that they know those numbers and they can use those numbers to be able to empower themselves to really manage their own health.
Wow, that's real, and it matters to have these health touch points in our community. On average, I can speak for myself. I may donate blood more times than I see my primary care physician in a year. So those blood pressure and hemoglobin checks before donating really does give me valuable insights in between my doctor's visits. So thank you so much for sharing that with us. And Dr. Miller, we open tonight talking about health beyond the scale. Can someone have a healthy weight but still be at risk for diabetes?
Absolutely. And, again, as you said, we know what that number is. When we step on that scale and step off that scale, we embed that, basically into our brain. But in terms of, can a person have a healthy weight and still be susceptible to diabetes? Answer to that is absolutely yes. As a matter of fact, one of the things that occurs when a person can have diabetes is that they continue to lose weight, even though they are eating normally or even eating excessively. So one of the hallmarks of diabetes is because the body is not efficiently using the glucose or the sugar, as Dr. Chris spoke about in terms of having insulin and having insulin basically do its job. So an individual can have a normal appetite, continue to eat, and are continuing to lose weight. That's one of the hallmarks of diabetes. Also, excessive thirst, because the only way that the body can get rid of that excess sugar or glucose is the person continuously urinates. And so, of course, the more often you go to the bathroom, the more thirsty you're going to be. Additionally, one of the symptoms of diabetes is the person is excessively tired, again, because the body is not efficiently using glucose and sugar in the usual way. The person is excessively tired. So back to the first question, yes, having a normal weight, a person can still be susceptible to having diabetes.
And in addition to some of the hallmarks that you shared with us, are there any other early warning signs that people might be missing or ignoring in terms of symptoms that they may be experiencing?
Well, certainly, excessive hunger, again, because the body is not efficiently using the glucose, the person just is constantly hungry, even in light of, I said, as eating. The other thing is that I already mentioned the excessive thirst. I pretty much have spoken to all of those additional things that a person can experience when they have diabetes or prediabetes.
Okay. And we've seen sometimes where people may not see any of those warning signs, but yet still have it. And so we thank you for sharing some of those early signs, those early warning signs that people just might be missing or ignoring that are there. So if you just tuned in, the NAACP and American Red Cross, we're talking about diabetes prevention, important health screenings, and how our communities can power our health. If you have any questions for our panel of esteemed doctors, please drop them in the comments and we'll try to answer as many as we can during our Q&A portion. And also, if you haven't shared this yet, make sure you share, you like, so that we can raise this up and our friends and our families can also get an opportunity to access this great information that we are receiving tonight. Dr. Chris, let's address the elephant in the room, shall we? In the U.S., more than 19 million people live in a food desert, with 1 in 4 Black people experiencing food insecurity and 12.1% of Black Americans disproportionately affected by diabetes. Is there a connection, and what's driving this disparity?
Wow. So first, let's define the term disparity. In health, public health and healthcare, we use that word a lot. And how I want people to understand it is the disparity is the math. There's some inequality, right? There may be inequality in which groups among racial and ethnic populations suffer or experience a condition. There may be inequalities on which genders or which sexes experience a condition. So that's what that disparity is, an inequality. But then there is a barrier and inequity that's driving the unequal health outcomes. And so let's begin to have a conversation around why is the math unequal for certain populations? You heard us use the word historically marginalized communities or populations earlier in this session tonight. That's because of social and political determinants of health that influenced which resources are available at the neighborhood level that then are factors that either contribute to, shape, influence, or determine your health and well-being. The fact that 12.1% of Black adults have been diagnosed with diabetes, and there are some differences by sex, right? That's about 13.4 for Black men, 12.7 for Black women, and that Black adults are 60% more likely to have diabetes than non-Hispanic white adults, right? Why is that? Black Americans are more likely to experience severe complications from diabetes, such as hospitalization and end-stage kidney disease. Why is that? Even if we begin to look at children, we see some of those disparities. And that is because of those social and political determinants of health, how conditions in your neighborhood or different policies impact the availability or the accessibility of healthy and affordable foods. You hit the nail on the head. You said food deserts, right? We speak truth to power in the NAACP. What is a food desert? I used to work as a hospital executive at a safety net hospital in Newark, New Jersey. When I walked outside of my hospital, I walked into a fried fish truck immediately across the street. I walked down to the edge of the block. There was a Checkers, there was a Burger King or Wendy's, and a McDonald's, just within a few paces of a hospital door. That's actually a food swamp, right? So there are too many unhealthy and affordable unhealthy food choices. So that's a swamp. A desert is something my mom taught me when I was a little girl. I grew up in a predominantly Black urban environment of East Orange, New Jersey. Still living in New Jersey. So shout out to New Jersey. But my mom used to say, Chris, I'm going to drive to a different neighborhood because the access to lean cut meats, the access to healthy and affordable produce or fruits and vegetables, it's different than the access that we have in East Orange. And that is because of policies or political agendas or things like zoning, what is allowed to be sold where and at what price points. It's also because of things like access to green spaces. The neighborhoods that we live in, if those neighborhoods are disinvested, if those neighborhoods are under-resourced, If those neighborhoods have concentrated poverty, you are likely to see a host of conditions that contribute negatively to health outcomes. So not only do people live in a desert that doesn't have healthy and affordable food, or live in a swamp that has too much unhealthy, affordable food, they may not have access to green spaces so they can engage in physical activity. So it's a double whammy. They may not have access to, clean, safe, and complete streets. So it's not promoting them to go walking or to go outside. There may be community violence. And because of this, there's toxic stress, which worsens health conditions. And finally, Tiffany, if we're really going to name the elephant in the room, because of systems of oppression like racism, like sexism, like other castes that assign a social value, if you will, to a person from a certain racial or ethnic population, that contributes to increased risk for worse health outcomes. So it's so important that we talk about what the what really is so that we can begin to talk about how we solve it.
Oh, the elephant has been exposed in the room. Thank you so much for sharing these powerful insights about caste systems and social determinants of health, and even the importance of having access to green spaces. Building on that, Dr. Lawrence, we hear a lot about exercise and nutrition being the key to preventing or reversing type 2 diabetes. But here's what people really want to know. Does someone need to lose weight to lower their A1C?
Thank you, Tiffany. And I want to thank Dr. Chris for the term food swamp, which I had not heard or utilized before, but definitely can be accurate because we know not all food is created equal in terms of nutrient value, and all of those things are very important. We can't treat everything with the same broad stroke. Is weight loss and diabetes management mandatory in all cases? Not necessarily, but we do know it's highly effective. Weight loss is highly effective at improving blood sugar management and decreasing the risk of diabetes. So we talked a little bit earlier that body weight and body mass index, or BMI, which is a calculation that's based off of your height and your weight, for many people are useful measures that really can correlate to heart health and diabetes risk, but we know that they're imperfect. For example, muscle mass is not really taken into adequate account when we're looking at weight or BMI alone. Another aspect that Dr. Chris touched on is the distribution of fat tissue also contributes to risk. For example, if you happen to carry more of your weight and fat tissue around the midsection, that's a higher risk for heart disease and for diabetes. And so while weight and BMI are not the only focus of interventions like nutrition and exercise, many would say that they are useful targets because they're really easy for people to measure and monitor. As Dr. Miller said, most of us know what that number is on our scale. So for people who do have both obesity and prediabetes or diabetes, the research does show that for many individuals, even a small percentage of weight loss, maybe 5% of our overall weight, which may be as little as 5 to 10 pounds for some, can really increase a person's body's sensitivity to insulin and can help decrease their A1C and help regulate their blood sugars. So how do we measure the success in reversing prediabetes or diabetes? Well, really success is seen in a decrease in that A1C value, which really suggests that your blood sugars are under better control overall. That usually means that your body is utilizing its insulin better and that sugar is making its way into the tissues that need them for fuel and not overwhelming your blood system and causing damage to your organs. For a total reversal of diabetes or prediabetes, it would really be the goal to see your A1C enter the normal or near normal range without requiring dependence on medications like insulin, and with a sustainable, and that's the key, sustainable diet and exercise regimen.
Thank you so much for explaining that to us, and also talking about what success looks like in reversing prediabetes or type 2 diabetes. I'm curious to know, what role can intermittent fasting play in helping to reverse prediabetes or type 2 diabetes?
Intermittent fasting, definitely a hot topic. And the truth is, it's one tool that's been shown, at least in the short term, to really help with weight loss for many people, with the overall idea that it's promoting a less caloric intake, so less calories in, and allowing your body's insulin levels to decrease during those periods of fasting so that your body can start to use your other fat stores for fuel. There are multiple different types of intermittent fasting plans. For example, there's the 16-8 method, where someone restricts their eating period to only 8 hours a day. The rest of the 16 hours they're fasting, and that can be timed during periods of, say, sleep, when we know we're naturally fasting. And then there's the 5-2 fasting method, where someone eats their regular average diet for about 5 days during the week, and then on 2 days of the week, usually not 2 days together, they cut their food or calorie intake substantially. But the real key to success in something like intermittent fasting, much like many lifestyle changes, is finding something that's sustainable for the long term. No effective lifestyle plan is a one and done. So you have to really consider, how does any one fasting plan fit into your daily routines? How can you incorporate that fasting schedule in a way that promotes other priorities in your life? As Dr. Chris mentioned, getting a full schedule of sleep in. We know that's very important. Having enough energy for your hobbies and exercise. So if your fasting periods interfere with your energy level to, do the things that you enjoy in life, that's meaningful, and we need to work around that. And even if meal times are highly important to your social relationships. For many of us, food is love. Food might be how we show love to our relatives or spend time with our friends. And so there's that complex relationship that we all have to our food and our food schedules. And so, not to say that we have to keep everything the same as it was, but seeing how you can tailor a fasting or other type of nutrition plan to allow you to keep the most important aspects of your life also socially is incredibly important. I know Dr. Miller and Dr. Chris have also had extensive conversations about the nutrition space and intermittent fasting out with other community members on how to make it accessible and sustainable long term. So of course, I invite them to weigh in if they have other tips and tricks.
Sure, I'll lean in here, Dr. Lawrence. I was just in community this past week, and I was having a conversation actually with a peer and a very good friend. And she was explaining to me, she's been living with overweight and obesity since her childhood. And she had suffered a couple of musculoskeletal injuries that really impacted her ability to engage in physical activity. And so as a part of her care with her primary care provider, they were looking at her food and her nutrition, and they were looking at physical activity. So she was telling me how she got a trainer, she was going to her local Y, she was engaging in safe physical activity. It was helping her to improve some of the issues with her knee. And she said, I've lost 20 pounds. And what's really been helpful for me is, she says, I go to bed earlier, right? Again, sleep hygiene. Adults are recommended to get anywhere between 7 to 9 hours of sleep a night, depending on the individual. And she said, I'm going to bed earlier, so I stop eating at a certain time. She says, I don't eat after 8 p.m., and I'm usually in bed by 9 or 9:30. So just as was being explained, sometimes intermittent fasting looks like stopping to eat after a certain time and then going to bed within the next hour or hour and a half. And I think it's really important for people to hear stories like that so that they can problem solve in their own lives and think through ways that they can take these difficult, complex topics, intermittent fasting, what is that? And just say, hey, what if I went to sleep earlier and got the recommended sleep hours that I need to be well, a whole person wellness, and that means I'm going to cut off eating at a certain time.
Oh, that's good. Thank you both so much for sharing, Dr. Lawrence and Dr. Chris. Now, I'm curious about the other side of this, Dr. Miller. We've been talking a lot about nutrition and physical health, but mental and emotional well-being matter too. So from your perspective, how can mindfulness or meditation support overall wellness and prevention of diabetes?
So I do have to speak to the sleep-wake cycle that both Courtney and Dr. Chris spoke about, is that continuing to have that conversation and emphasize that getting enough sleep is an incredibly important part of maintaining a healthy weight. And that this conversation that we're having tonight, hopefully our audience understands the importance of getting an adequate amount of sleep and how that can be a really important part of maintaining a normal weight. So let's talk a little bit about whole health. You're going to hear this term, whole health, more and more over the next coming years, because that's part of the conversation that we're having in our country, is that so much of our lives, particularly as we interface with the medical community, is compartmentalized. You see a cardiologist for your heart, you see a kidney doctor. So conventional medicine has compartmentalized how we see our health. But with this whole health model, we look at ourselves as, mentally, emotionally, physically, and spiritually as a whole person. And an important conversation that you're hearing more and more often now as well is people who you never imagined talking about mental health and well-being. You hear celebrities, you hear men who generally we think don't focus so much on mental health, but we have so many people now who are speaking out loudly that other things in their life may have been going well, but they were having so many mental health issues. So focusing on wellness encompasses every part of our lives. And some of the very simple things that we can do to just get into that calm space really quickly, and you've heard this talked about quite a bit lately as well, is meditation and mindfulness. Mindfulness simply is paying attention to how you are feeling mentally, emotionally, physically, and spiritually, thinking about all of those things and taking into account how that affects how you interface with others in your life and how you feel every single day. And then meditation generally involves what's called breath work, which is simply just taking deep breaths in and exhaling, with the exhaling cycle being longer than the inhaling cycle. So, for example, an a count of 5, you inhale on a count of 5 and exhale on a count of 8 to 10. So with that exhalation cycle being longer than the inhalation cycle, that drops your heart rate because it engages what is called the vagus nerves, which helps us calm down. You've heard of the fight or flight response. When our body is activated, like when we're running away from something, cortisol in the heart, it causes the heart rate to increase. But then the opposite of that is when we start to calm down, the heart rate starts to drop. So this inhalation and longer exhalation cycle causes the heart rate to drop and you feel more relaxed. So I encourage you to take just literally 5 minutes several times a day to just go to a quiet place. You don't have to sit down. You can be standing. You can do whatever you feel comfortable doing, and just that short inhale and exhale, and then focus on how that makes you feel. Does it make you feel calmer? Do you feel like you have more energy now to deal with whatever is in front of you? So that simple breath work is incredibly important to how we show up in the world. And again, looking at ourselves holistically.
Wow, thank you so much, Dr. Miller. I think that's going to hit home for a lot of folks, including myself. You suggested some amazing tools that we can use and put in our tool belt, like breath work during the day to really calm ourselves and our nervous systems. The NAACP and American Red Cross are talking about diabetes prevention tonight and how to access proper nutrition, the importance of that, the importance of our health and our wellness, and how our communities can improve our health together. And it is time for our audience Q&A. So if you still have any questions for our panel of doctors that you haven't dropped in the comments or the chat yet, please drop them in and we'll try to answer them as many as we can. So keep close. I can tell you right now, we have a question from Renuka. She asks, knowing that donors sometimes go to a blood donation center more often than their primary care provider, she asked if this A1C testing offering will continue into the next year as well. Dr. Lawrence, do you want to respond to Renuka's question there?
Absolutely. Thank you, Renuka. Yes, so we are very fortunate to have some excellent community sponsors and partnerships that have been able to fund us to extend our A1C testing to several months this upcoming calendar year. So November is, of course, Diabetes Awareness Month. So we're very excited to offer it through the end of this month. And then it will be returning during American Red Cross Month in March of next year. And again, during Diabetes Awareness Month next November.
Awesome. Thank you so much, Renuka, and thank you, Dr. Lawrence. Dr. Chris Purnell, here's a question from you from Jay. Jay asks, is weight gain due to perimenopause or menopause? For example, menobelly, is that a contributing factor for diabetes?
Such a good question. And especially since I'm getting ready to turn 50 on Sunday. And these past few years, I've been in perimenopause. And I can recall doing my annual exams with my primary care physician about 2 to 3 years ago. Some of my numbers started to be different. Much hadn't changed with my physical activity, and much had not changed with my diet. But my numbers started to change. So my fasting glucose started to tick up. My LDL started to tick up. And now we're having a bit of a menopause revolution, if you will. Our practitioners are learning more information because unfortunately, when we were in medical school, we didn't focus our medical education on menopause and the whole transition of premenopause, perimenopause, and postmenopause. So, but Jay, yes, you can see during the menopausal transition, several things happening. You can see the fluctuation in hormones, and that fluctuation in hormones can lead to a woman who is more likely to gain weight around her abdomen or her belly. But that may not necessarily be true for every person going through menopause. And it's not always due to the hormone changes by themselves. It could be due to other lifestyle and genetic risk factors that you may have. For instance, when you're in the menopausal transition, your muscle mass is going down, not just during that time, but because you're aging. And so your fat is increasing, your muscle mass is going down. And as your muscle mass is going down, your metabolism slows. Your body isn't able to use calories the same way that it did before. So you can see an increase in fat around certain areas of your body. And again, you might have increased fat or increased a belly, a menobelly, as some people call it, or you might be doing less physical activity. So I say that to say, while hormonal changes definitely are at play, it's important to fine tune your diet, meaning really focus on what you're eating. I started to ask myself, Chris, are you snacking more at night? When I'm starting to see some of these changes, I didn't think I was snacking more, but I took that intentional pause to ask myself that. And I looked at my physical activity routine to make sure I was building muscle. It's so critical as we age, and especially going through the menopause transition, that we build muscle so we can prevent some of the risk of gaining fat, that metabolically active fat, in places that'll put us at risk for the changes in our numbers and perhaps actually developing diabetes.
All right. Thank you so much, Dr. Chris, for that. And thank you, Jay, for that question. Jessa asked if she should prepare for her blood donation appointment any differently this month or this year, knowing that the Red Cross is offering A1C testing. Dr. Miller, would you like to answer Jessa's question?
Yes. And again, thank you, Jessica, for asking that question. Prepare for donating during this time where we're providing hemoglobin A1C testing. Again, just making sure that you eat a healthy meal, that you are hydrated when you come to donate. There is nothing special, additional that you need to do. Just come prepared, again, having had something to eat and drink before you come to the donation site. And individuals that have diabetes, as long as their diabetes is well controlled, again, we encourage everyone to take advantage of the hemoglobin A1C testing, and definitely people with diabetes can donate blood. And this is, again, is an opportunity to find out what your hemoglobin A1C numbers are.
Okay, thank you so much for that, Dr. Miller. We have another question in the chat from Erica. Erica wants to know, one second, if intermittent fasting could possibly help a type 1 diabetic. Dr. Lawrence.
Sure. Thank you for the question, Erica. So there is starting to be some research with things like intermittent fasting for those with type 1 diabetes, but it's still much more limited than the research of intermittent fasting in other settings. So some of that research does suggest that it could be potentially beneficial for overall blood sugar control. However, the risks can be higher. And so really, when it comes to someone with type 1 diabetes who very much relies on a consistent insulin schedule and close monitoring, because they can have blood sugar drops that can be life-threatening in addition to high spikes in blood sugar. It's really recommended discussing with your healthcare provider and making sure that you have a good actionable plan for monitoring those blood sugars and adjusting your insulin dose around it. So I would say, if you're interested in it, bring it to your healthcare provider, because there may be a role for it in your care.
Wow, that's awesome. Thank you so much for explaining what can and cannot be done with type 1 diabetes. We appreciate that question, Erica. Dr. Purnell, the NAACP has been on the forefront of diabetes awareness and advocacy for many, many years, even encouraging NAACP units to reduce the use of sugar-sweetened products and encourage consumers to make healthy choices. And we often hear that diabetes is tied to both genetics and lifestyle, but how much of this is within our control?
So, very good question, Tiffany. Let's talk first about family history, because we talk a lot about whether something is inherited, because we see it in multiple family members, when habits also travel in families. Families are social circles or social units or networks. So members of a family may have a similar diet pattern, or members of a same family may have similar physical activity routines, or members of a same family may have a similar sleep hygiene. Like my siblings and I, we were known as the night owls or the night hawks. We stayed up really late. And so our mom would be like, you ultimately have to go to bed at some point, right? And so I say that to say, I want people to understand that small changes matter and that you have power over your health outcomes, even if there are certain risks that exist within your family unit or risks that exist in your neighborhood. And we in the NAACP are very much about using our 7-point advocacy model, right? And a part of that is education, increasing health literacy, like having information about our health and well-being and knowing how to use that information, and then knowing what conditions in the environment contribute to certain health outcomes. So beginning to help people to understand how physical activity has an impact. Do they have access to green spaces? Are they advocating at their local level for access to healthy and affordable food? What are they bringing into the household? Are they having conversations around food? So yes, you have power to institute and enact changes. Yes, small changes matter. But we need those changes to also happen at the community level, also at the neighborhood level. And that's why we in the NAACP have done things like our ACE Your Health Community Wellness Survey to help people understand those social determinants of health that are very much a part of the primary drivers of your health and well-being outcomes. So if you haven't already heard about ACE Your Health, please go to the NAACP website, naacp.org/ACE-your-health, and get more information about the ACE Your Health portfolio. And we're going to have a report that helps people all across the United States understand what's happening in their community and what they can do to bring change, not just in their household, not just in their family, but within their community and social circles.
Wow, that is powerful. Thank you so much for putting us on to the Assure Health Initiative. You all are promoting and engaging communities with, and the information that you'll provide us from your insights. We look forward to hearing more about that. Jeanette asks, is it true that donating blood regularly can lower blood pressure in someone with high blood pressure? Dr. Lawrence, I see you smiling.
Thank you, Jeanette. So yeah, there is some growing body of research that shows that regular blood donation can improve several different metrics of your health, including average blood pressure, especially in individuals who tend to be in the hypertensive or high blood pressure range, and that it may decrease the risk of certain heart health complications like heart attack, which is excellent. It's great when you can see a health benefit in addition to feeling like you're otherwise supporting your community by donating blood. I just caution also that it is not a stand-in for other ways of being able to manage your blood pressure, but it's a really nice adjunct to the things that your physician team and your other healthcare providers and we have discussed on this call.
Wow, thank you so much for clarifying that for us, and thank you for your question. Dr. Miller, for someone who's received a concerning A1C result or a diabetes diagnosis, what would you say to them? And can people with diabetes, you mentioned earlier that they can still donate blood. I know that there are a lot of people who just don't believe that once they get that diagnosis, they can. So again, what would you say to someone who's received a concerning A1C result or a diabetes diagnosis?
So the first thing that I'd say is take it seriously, and that it is something that you can control. And we have talked about this throughout this entire conversation with simple lifestyle changes. There are, again, increasing exercise, and again, just losing just like 5 to 6 to 7 or 10% of your weight can really stop the progression of diabetes. So there's nothing huge that you have to do. First thing, take it seriously, see your healthcare provider, and commit to making some lifestyle changes. And you may never even have to go on medication or have to take insulin, because just a few simple lifestyle changes can decrease that hemoglobin A1C, keep that blood sugar under control, and can lead you to having, a much healthier life in the spectrum of having that concerning hemoglobin A1C or being pre-diabetic. So again, looking at your whole life holistically, mentally, emotionally, physically, spiritually, and taking those few minutes every single day to sort of bring yourself in, calm yourself down, lower that heart rate, and just really get yourself into a positive headspace can help tremendously as you also deal with your diabetes.
All right. So Lisa asked, can you explain why diabetes can lead to high blood pressure, or maybe even why high blood pressure can lead to diabetes? Anyone want to take that? Dr. Lawrence?
I would just say it's again, looking at everything that you're doing holistically, eating foods that have high salt content, that are not healthy for you, that increases your blood pressure, and eating high calorie foods increases your weight. And so it just becomes this cycle that leads to hypertension and diabetes. So that's how I speak to it.
Okay. Thank you so much, Dr. Miller. And thank you all so much for tuning in and all of your questions. Just really quickly, from our panel of doctors, if you could just, leave us with one tip for someone, whether they're pre-diabetic, at risk, or just want to be proactive. What's one thing they can do to take control of their health? And we'll just do a quick round robin, starting with you, Dr. Chris.
The one thing I want to emphasize tonight is that the power is in your hand, so move more. Do physical activity snack breaks. They were calling them physical activity snacks. Throughout your workday, stop and do some air squats. Walk more. Walk after you eat a meal, right? Ways to help your body digest in a healthier fashion. And so know that the power is within your reach. And so I'll just give you that one nugget around physical activity.
Thank you, Dr. Chris. Dr. Lawrence.
I think probably one of the most effective things when we're talking about lifestyle changes is build your support network, identify your community, whether it's your best friend, whether it's your family, ask them to help encourage you and to help hold you accountable to your healthcare priorities. Let them know that this is something that means a lot to you. You're trying to stay healthy, to be there for them long term, and none of us should act as an island alone. So reach out to your network and work together as a team.
All right. And Dr. Miller.
Pay attention to yourself holistically, mentally, emotionally, physically, and spiritually, and take those moments every single day to practice mindfulness and do that simple breath work with the inhalation cycle. Let's say a count of 5, and then the exhalation cycle on a count of 8 to 10, and you can feel your heart rate decreasing. So those are my words.
Awesome. Well, thank you all for sharing these valuable health insights and helping us understand diabetes awareness beyond the scale. Thank each of you for tuning in and being a part of this conversation. We know that diabetes impacts over 38 million people in the U.S. and nearly 25% don't know they have it. Sharing this live with your friends and family and taking back our health together is a form of real liberation. Did you know that this National Diabetes Awareness Month, the Red Cross is offering free A1C screening to all blood, platelet, and plasma donors? That's right. And you do not have to fast before you give. We're offering this to donors. I should say you should not fast before you give blood. We're offering this offering to donors who have not received this screening with Red Cross in the past 12 months. So whether you're donating blood or money to support community wellness, checking your A1C and blood pressure, getting more quality sleep, or committing to move your body more, every action counts. So visit redcrossblood.org to schedule your blood donation appointment today. And where would we be without the NAACP? To support the incredible work of the NAACP in increasing awareness and improving the social determinants of health, please donate to the NAACP by texting GIVE to 20707. Again, that's GIVE to 20707, or you may visit naacp.org/donate and make a donation today. Until next time, take care of yourselves and each other. Good night.
Good night, everyone.
Good night.
Nice.
Take care of yourselves.